Ashley from Nine Health, and we're out and about showing you where health happens. And today we're with the team at Dispatch Health to show us how they're kind of revolutionizing the way that healthcare is delivered. So I'm here with Phil, the medical director, and I'm here with Karen, the nurse practitioner. And just tell us a little bit about Dispatch Health. How did it get started, or what kind of technology are you using?
So Dispatch Health came out of the need to make sure that we had a way to provide healthcare at a lower cost, at the right place, and the right time, and a way of providing healthcare that's a lot more convenient.
Okay.
We started in the 911 system and partnered with South Metro Fire to see if it was a feasible product, and obviously it was very successful. And in 2015, we started Dispatch Health as it's known today privately from this office, essentially, going out and providing care to people in their homes, providing care at the workplace, providing it in assisted living or independent living, and we've been doing it since then.
Anywhere people are.
Anywhere people are.
Very nice.
You're in a field somewhere, we'll come and see you.
That's good to know. We're actually in their call center right now.
Dispatch Health is
They're receiving a call right now, so we're going to head this way and take a look at their supplies. So that's kind of the process, is you get a call from someone needing care.
Correct. Somebody will need care. They will either contact us through the website, through a mobile app, or as you just saw through the call center, they'll call in. Our clinical support team member will screen that call to make sure it's an appropriate call. If it is a time-sensitive call, somebody's calling and they say they can't move on one side of their body, we think they need to go to the hospital right away. So we wouldn't want to interfere with that care that we've recommended or call 911. If it's an appropriate call for us, we would then gather all their information, we put it into our proprietary dashboard, and then assign one of our providers, so a nurse practitioner or a physician assistant, who goes out coupled with EMT and has an emergency physician kind of supporting them on the route.
And they're prepared to do a variety of things, right? So over here are your supplies. Sure. Karen, do you want to tell us about what you got over here? You got a lot of goodies here.
We pull out our big kit. I'm going to pull it out of here. So this is our jump kit, and this is what we bring on every call. And it basically carries just about everything.
Oh my.
We have a slew of oral and IV and injection medications. And we also have needles, all of our supplies to take blood pressures. We also have a glucometer to check blood glucose. We can look in your eyes and ears. We can get weights for children.
Wow.
This is basically how we start all of our calls.
Okay.
So we would show up on scene, start evaluating the patient. The nurse practitioner or PA would start asking questions. The EMT would start doing vital signs, kind of we start gathering data, we get their medication list, their health history, and then try to start sorting out what's going on with them and how we can treat them.
Very nice. And it looks like you're also able to administer some basic medications too.
Yes, we have oral and IV medications. We carry anti-nausea medications, some antibiotics, so if we're treating an infection, we can start treating right then and there at the scene. We also carry a variety of kits for every body system, so if someone has fallen and injured their arm and has a laceration, we can numb it up, clean it up, and then either sew or glue it up.
You can do that right there.
Right then and there.
Okay.
We've sewed kids' heads up on the kitchen table.
So yeah, Karen and I sat down when we were starting this and said, what are the most common minor emergencies that are seen in the emergency department? What are those things that are done in urgent care centers? And what can we translate from what we're doing here into people's homes?
And what can you put in a nice little consolidated bid?
Yeah.
Exactly. So we carry one of each one of these kits into each home, depending on what we need. If it's an eye problem, obviously we wouldn't need the laceration kit, but we have an eye, ear, nose, throat kit, and we have a respiratory kit, so all those things. So if somebody's wheezing and they need a breathing treatment, we have the ability to go in there and take care of them.
And every single car is equipped with all of these supplies.
Correct.
So you're ready for anything.
Yeah, we leave the office in the morning at 8 for our first call, and we can be out for 10 hours and not have to come back and restock. We carry everything. We put in Foley catheters, IVs,
Wow.
IV fluids.
EKGs.
We have an EKG machine. We can do just about everything for minor, emergent, and urgent care type calls right then and there.
One of the really nice things that we can do is sometimes physicians will have a need. My patient had abnormal labs, and we're concerned about that. We actually carry a mobile laboratory.
Okay.
So we are a CLIA certified lab, so we can go out on scene and we can test for infectious diseases, so strep,
Wow.
mono, influenza.
Okay.
We have a lactate kit. We can also test for chemistry, so all of your basic electrolytes, kidney function tests, we can do right from this kit.
You know what's so great about this too is that a lot of times when you're sick, you don't want to be going into somewhere where you can take your germs and spreading them around. So this is keeping you contained in your home,
Correct.
keeping your germs in your home.
Yes.
And you bring the kids
And,
into
and nor do you want to, you don't want to sit in an emergency room, waiting room for 6-7 hours,
Mhm.
especially if you have to tote your kids along
Yes.
with you when you're feeling poorly.
Yes.
So you can wait in the comfort of your own home, and then we give you a call when we're on our way, and we'll show up at your doorstep and provide care right in the minute.
And that's a great thing you mentioned too is that, you know, our time is so precious and so valuable. So the average wait time for a dispatch health service would be what, like 45 minutes on average, or?
On average, it's right now we're seeing it somewhere between 45 minutes and an hour.
Okay.
So, but we give you an update. So you
Okay.
call us, and if somebody called right now, we'd be in their house as soon as we could drive.
Mhm.
But there's other times if we happen to be set up, it might take an hour to get there.
Sure.
But if our providers are out and about, our clinical support center would say, hey, this is our ETA. That we're going to be at your home, and usually that's within about 5 minutes.
And then talk to us about fees. So you do take insurance, right? Or you do work with certain or insurance providers?
So we take almost every type of insurance. There are a few subtle ones that we don't do, but all the big ones and the national ones that we do accept. For those that few that wouldn't have one of the big ones, we do have a flat rate fee of $225 for anything that we do, including all of this testing if a patient happened to need that, which is dramatically decreased from what you would see if you went to the emergency department, where the average fee is about $2,200.
Wow. So no matter what, you win. And that's the other thing too we hear is that it's very confusing to know what your fees are going to be. If you have insurance, you're calling around, what's it going to be for this, what's it going to be for that, and it's hard to determine. But with you,
Well,
you
it
know.
is difficult. Every patient's insurance has a different plan. We submit directly to the insurance, but if you do have a high deductible plan, you would be on the hook for the charges.
Okay.
But if you did not have insurance at all, it would be a flat fee of $225.
Very nice. Well, at least you know. At least you can tell them straight up.
What?
We have a question here.
We do. Perry wants to know, what is their service area and how do you get a hold of them?
Great question.
So you can go to the website, which is dispatchhealth.com. You can download our app from the App Store, which is Dispatch Health, or you can call us at 303-500-1518, and there's somebody at the Clinical Support Center that will answer that almost all day long. Essentially 8 to about 8 p.m. we have somebody answering those phone calls. The service area currently is up to Louisville, Boulder, and down to Castle Rock. We are very soon, so this summer we'll be expanding into Boulder as well.
Very nice.
Otherwise, it's the 470 corridor, the big circle.
Oh, okay, there you go.
And everything in between.
So if you live in the Denver metro area, pretty much we can come and see you.
Covered. Okay.
And if you go onto the website, you can plug in your zip code, and it'll tell you if we service you.
Perfect.
Yeah.
Okay.
Thank you, Perry.
Yeah, thanks for the question. One thing as a nurse practitioner and provider that I enjoy when we're on scene is we spend approximately 45 minutes on scene with the patient. So we are getting to know them, their family, their situation. We help bring in resources if they need help with transportation or food or home health.
Okay.
Obviously, if it's something simple, sore throat, we're in and out of there quicker, but we are spending significantly more time than you would in an office visit or even an ER visit for that matter.
Giving really personalized care.
Yeah, and because of that, patients are very happy, and so are we.
That's good.
Yeah, and my whole career has been an ER physician, so even though you may be in the ER for many hours getting care, that one-on-one time is pretty limited because you have to go and bounce in and out. When Karen or one of our other nurse practitioners or PAs is on scene, it is one-on-one for 45 minutes, just seeing and taking care of that acute issue.
We're not leaving until we take care of what you
Yeah.
called us for.
We're evaluating, we're examining, we're diagnosing, we're treating, and then we're wrapping it up. If you need a prescription, if you need a specialist referral, we'll also call your primary care doctor and make sure you have a follow-up appointment so you can make sure you're getting better or getting what you need the whole time.
So we have another question. Is the service you provide 24/7?
It's not. We start at 8 o'clock in the morning and then we end at 10 p.m. 7 days a week, 365 days a year, including holidays. So there's always something available.
Something always happens on
You don't want to knock on someone's door at 1 in the morning. That's just not. So there are limited hours, but it's a good 14-hour day.
Okay.
And what we found is that most of the time, even in our big urban ERs, the volume goes down overnight. So we want it to be somewhat early at 8 o'clock and later than most people are open until 10 o'clock. But we didn't think there was much value of going overnight because of the medical center.
Sure. What is one of the most common things that you do get called for?
So it depends on the season, and flu season just ended. So during flu season, that's the number one. But there are a lot of urinary tract infections, lacerations, other cases of shortness of breath. We do see a lot of nausea and vomiting, and for good reason. That's one of those things where if you wind up, if you're that sick, you wind up going into an ER, as Karen mentioned. What a terrible place to wind up in the waiting room, throwing up or those things. So those are some of the big and common ones. But we see a lot of other things. We see patients that have chronic obstructive pulmonary disease and they have shortness of breath and they need steroids and breathing treatments. We can go out and take care of that as well.
And in the summertime, we have, injuries. People are out and about rollerblading, doing activities, and so we have some minor orthopedic injuries and lacerations and wounds. So the season definitely changes.
We have a lot of questions coming in. So one person, Chris, says, my daughter Hannah is graduating with a BS degree in integrative health from Metro State and wants to know if you guys are hiring.
Great question.
So we're almost always hiring as long as the person fits the right needs. So Jackie, who's right there, hires our EMTs. And we do have some needs for additional nurse practitioners and physician assistants, but if you're an EMT, we're looking for EMTs.
Another question is, do you take care of people with disabilities?
Yes, of course. We take care of basically anyone from birth to 100 plus years old. We're all family practice providers, and we can take care of people with disabilities. I'm not exactly sure what, it's acute care, so if there's injury or illness, of course, but nothing chronic.
So we wouldn't be their primary care provider going forward, but one of our specialty areas is homebound. So though there are a lot of patients that cannot get out to their primary care provider, and they require a physician that does house calls to be their maintenance provider. But when something more acute happens, they don't have time in their schedule necessarily to go and see them. We can go and take care of that acute problem and determine if they are still appropriate for staying at home or if they need to be escalated to the hospital.
Okay, absolutely. And kind of like what you were saying earlier, your call center will kind of not evaluate to see if you're someone that is appropriate for that person to see.
Yeah, they pre-screen them. We have an exclusion and inclusion criteria, and we ask them questions to make sure that it is appropriate. So there's not a delay in care.
Okay. I asked them earlier if they take care of pets. And at this time,
we're not taking care of pets. I take care of my own pet. But there's no vets in here. Just nurse practitioners, physician assistants, and physicians.
Just humans.
Just humans.
Do you want to go take a look at the car?
Sure.
It's not as big as you would picture.
No.
It's kind of it's an efficient little vehicle. We're out here in the Rhino area. You've always been in Rhino?
Yes. The very first couple of weeks that we opened up, we were in the Denver Tech Center.
Okay.
Just as we were waiting for this office to start up, but from September 2015 until now, we've been right in that office. We've actually expanded into the lower half of that.
Okay. So if they get dispatched, then here they come after their car.
Yes, so we
These
have
cute little
a
things.
cute fleet of 4 dispatch rovers, as we
Okay.
call them. They're our pre-I fleet. And you'll see all of our kits are loaded into this car. And we'll open up another kit. This is our IV kit.
Okay.
So if you have vomiting, diarrhea, and are
wow.
dehydrated, we can start your IV. So yeah, all of our kits are packed in here, and on our dashboard we will have our iPad with our map. So All of our cars are geolocated.
Okay.
And so when we are dispatched out, we on our dashboard select our patient, pops up on the map, and then we kind of know where we're going. And then when we have 4 cars currently on every day.
Okay.
And so we kind of divide up the map, and one crew will be up here, and so that's how we kind of keep our wait times down.
Absolutely.
We have another car embedded into the 911 system at South Metro. So on some days, like today, we'll actually have 5 different providers out and about. And then on June 1st, we will have the car number 5. So the Rover number 5 will be starting, and that will help service the Louisville and Boulder area.
Okay. And is there ever a time where you feel like it's overwhelming, or you're short on supplies and you're running back and forth to the office, or these are pretty well stocked to last the entire day?
We've learned a lot over the past few years.
I bet
and
you
as
have.
volume has ramped up, we have made adjustments to our kits. We also have a bin in the back seat that we can't see right now, where we carry some extra supplies, because some days you just have a run on people that need catheters. And so we have some extra IV supplies and catheter supplies, so we typically don't run out.
Okay.
Yeah.
And if someone needed transported, could you put them in this car? No. You don't
So
do that?
yeah, we thought of all those processes, and essentially, if we get on scene and somebody is sick enough, we have a process to either escalate to 911, or we can use one of the non-emergent ambulance services to help and give an assistance to transport that
So
patient
you really
to
thought
hospital.
that through, so that you wouldn't be taking resources, that you said non-emergent, so you can evaluate to see what kind
Correct.
of escalation required.
I mean, we think it's critical to make sure that it's the kind of the right place and the right time and the right cost. All those things have to be considered. So if we saw somebody on scene who we just knew needed a little bit more care or more service, or needed some higher level of imaging than what we could provide just in the home, we would not necessarily call 911, because then if somebody else was sick, that rig is out of service. So there are a lot of other services that come by and help us. That leads me to the other part, that even though we don't do imaging here, we've contracted with another service so that if we need an x-ray or an ultrasound to be done, we can arrange to have that done in the home as well.
Wow. Okay. That's a pretty
For,
great
for
service.
homebound patients, we can have someone come to you.
Okay.
For people that can drive their own car and get to places, we can send them to another facility that we work with to get those higher level studies.
You're really in the business of convenience and comfort, it seems like. You want to make
And
it
caring.
as convenient. Well, yeah, of course.
As
Make
a
it as
provider,
convenient
that's
for
caring.
people, make them comfortable, keep them comfortable.
Yeah, and
them in their home.
and cost savings too.
Yes.
I mean, the impact to the system on some of the higher level of care is significant. And so we're trying to do our best to keep costs down and keep, make sure we're using resources appropriately.
Yeah, what do they say, like 18 million ER visits can be avoided, or something ridiculous like that, but a large number of them can be avoided.
I mean, there's a large number that can be avoided. There's a large number of EMS transports that don't need to take place, but up until now, there haven't been a lot of other options.
Right.
So we really wanted to provide that option. And again, everybody involved in our organization really thought through how can we make this happen in a very, very safe way. It starts with that contact from our clinical support center. We don't want to be on the receiving end of somebody who's really sick and say, wait for us. We know that we're going to escalate that care, then we get the appropriate care to them, and Karen and all of the providers do a wonderful job of making sure that they get excellent care.
And the person they're speaking to in the call center is a medical professional, or they're trained to evaluate so that...
Any communication with us starts with somebody in the medical profession.
Very nice. Okay. You have a pretty big team. How big is your team in the state?
We do. We have 16 providers, a combination of nurse practitioners and physician assistants, and then we have about 8 to 10 EMTs right now.
Okay.
And then I think we have a handful of clinical support staff.
And like you mentioned earlier, every medical professional is a paramedic EMT, right? So they're going out.
Correct. It's a duo. It's a team effort.
Yes.
4 hands all on board. And then we also have about 6 is that correct?
Yep.
Virtual physicians who are in our pocket on our phone that we have contact with. So if there's any question about a clinical decision, we have someone to call, phone a friend.
And is it, at this point, is it contained to home or office? Like if I was at the Rockies game on Friday, I won't be, but if I was going to be and I got hurt, could you come to somewhere like that, or does it need to be
So
home or office?
Rockies game would be a little difficult because we don't have a ticket to go see the game.
Yeah.
Plus there's we like to maintain people's privacy.
Okay.
And so it would be really hard, in your seat to ask you personal medical questions.
However, However, so great story was we had some connections personally to the performers of The Lion King. And one of the members was ill, so we sent out one of our nurse practitioners, EMTs, backstage, went in, took care of it.
Their place of employment.
Yeah, it was their place of employment, and they got backstage at Lion King. So we can do things like that. So yeah, if it was something that we could work out and you could be given privacy, we absolutely could do that.
I've taken care of people at the mall. We just get one of their back rooms and taken care of people in stores, in offices. We just have to make sure that we have somewhere where we can talk. We go to hotels frequently too. People are traveling to the Denver area and don't have their primary care doctor, so they often would ask the concierge, hey, is there an urgent care? And so we have some relationships with some of the local hotels, and so we get to go to the downtown hotels and take care of people there.
It feels like that for that reason only there needs to be a dispatch health in every city.
We're working
just when
on
you're
that.
traveling, because you don't have a doctor when you're traveling.
Right.
So the goal is starting this summer, every 3 to 4 months to be in a new city.
Really?
So we're growing.
That's what's next for dispatch health. We're going to take over.
We're going to contribute
We're gonna contribute.
to the
There you
overall
go,
quality
there
of
you go.
healthcare.
Absolutely. Well, you're already doing that. We really appreciate what you're doing for us. I mean, Nine Health Fair is all about access to care, and we're on the preventative side, but then it seems like that's where you come in. Then after the prevention, if the prevention doesn't happen, then that's where the care happens.
And I've participated in some of those
Oh, you have?
health fairs, and I
Good.
think they're wonderful. And
Well,
it's a way to keep everyone healthy. We'd rather people be healthy than need our
Yes.
services, for sure. But we're an option if you need us.
We definitely try to, take care of those acute care needs, but we have a very close relationship with the primary care providers. So they get copies of our notes. They're done as soon as the providers sign off on their notes. It's electronically faxed to them so that they know what's going on with their patients, so they can actually keep them healthy for the long term.
Okay. That sounds great. Well, if there's no other questions, we'll kind of sign off here. But we're here with the Dispatch Health team, dispatchhealth.com. You can get more information there. Great service that they're offering to Colorado and hopefully beyond soon.
Yeah, thanks for your
Great.
time.
Thank you.
Thanks, everyone.